Chemotherapy can damage the nervous system, which is a progressive side effect that can be particularly noticeable in the hands and feet. This is called chemotherapy-induced peripheral neuropathy, or CIPN for short, and by the time that the patient perceives it, the damage can be permanent, and this can lead to further problems such as depression, sleep disorders, and reduced quality of life. We plan to make an easy-to-use device. This can detect peripheral nervous tissue damage before it is noticed by the patient. This would avoid permanent damage and suffering by those at risk of developing chemotherapy-induced peripheral neuropathy. So how could a device like this work? Let's look at an analogy with colour blindness. Colourblind people don't notice they have a sensory deficit because perception appears normal to them. However, we can determine that someone is colourblind when they report they can't see certain patterns in a colourblind test, known as the Ishihara test. Normal eyes have three main colour receptors, which gives them the ability to see red, blue, and green differently. So when you present the right pattern stimulus, the eye detects all three colours, which is required to perceive the pattern normally, and in this case, they should see the number 6. When you present the same pattern to someone who is missing one kind of receptor, they can't discriminate between the red and green, so they can't see the number 6 in the pattern. By changing the stimulus patterns, the Ishihara test can determine which kind of receptors are missing. Our idea is to make a test like the Ishihara test, but for the sense of touch. Like the visual system, the touch system uses multiple specialized sensory channels to relay information from the hands and feet. These sensory channels bring all the information the brain needs to interpret it into the rich experience of touch. A small amount of damage to one of these sensory channels may not be noticed by the brain, especially in the beginning. But once a sensory channel is completely lost, the perception is changed, and unfortunately it doesn't come back in many cases. If we can make a test like the Ishihara test, but for the touch system, we could intervene before damage is permanent. Intervention might mean changing over to another drug, which could give nerves a break from the current treatment. And catching it before symptoms develop would lead to less overall suffering for the patient. And because this device is easy to apply, patients can self-monitor and thereby eliminate the need to attend specialised clinics. Finally, to improve monitoring would enable better research into understanding the toxic effects of different chemo drugs on the peripheral nerves. We need this research because without a better understanding of the causes behind chemo-induced peripheral neuropathy, we won't have all the information we need to make better, safer drugs in the future.